listen in, but we are going to be recording this. Welcome. I'm actually really excited to see so many faces. I think it's great to see so many current students as well as alum. My name is Kara Kripple, @7. I always get excited that I can do that again. But I actually have the really great opportunity to kind of serve two roles with Elmira College. I am currently the Associate Dean of Campus Life. So I am reporting, I would say reporting live from my office in the Campus Center on Elmira College's campus. But I also am very fortunate to be one of the people that I always say throws these shindigs and has their hands in kind of organizing what we're doing. And I would be remiss if I didn't give a shout out to, and I'm going to introduce kind of my partner in crime, but Megan Mitro, @8. So I'm going to turn it over to Megan. I think your mic is not working. Technical difficulties, I think we've learned over the years, or even just this.
I know. I tried to do it just through my computer audio because I didn't want to do phone, but then phone, I don't know. Anyway, so yes, hi everybody, welcome. I think this is our highest attended event, so thank you all so much for joining. It's great to see so many faces. Some I know, some I don't, but we all have the same great connection to the college, so it means we're all connected. So first up, I would like to introduce Missy Velino, who is the Director and Associate Professor of Nursing Education.
Hi, everyone. For those of you who don't know me, I've been at Elmira College now. I'm going into my 19th year. And how I know it's my 19th year is my youngest child is 19 in March. She's also a freshman at Elmira College. So some of the students here today from alum actually remember my kids as babies. And I'm going to give a quick shout out. I have a couple current students who said they'd come here with me tonight so that if you guys had questions of students, you could ask. So I have Jackie Keller, I have Nate Swartz, and Abigail Velino, who is my child. So she kind of got her arm twisted and they all came to help me out. So if at the end of the presentation, you want to quiz the students, they're willing to give you their honest feedback and what they know about the college right now. So from where I started 19 years ago, we were in Carnegie Hall. On the 3rd floor is where my office was. The lab was so bad that we didn't really put that on the tour. We avoided that, and we trusted that, you know, we would give the students what they needed at our facilities, which were really nice and still are, that let us come for clinical. Today, the lab is the first place on the tour. It's a beautiful lab. We're very fortunate. If you haven't been back to see the lab, it's absolutely beautiful. We have a full swim suite with high fidelity mannequins, 2 practice labs, a lot of really great stuff. We've grown the program. Currently, we have about 60 students graduating this year, and that's about our average class size is about 60. Back in the day when I started, I think I started with a class of 15. And now we're up to 60. So that's pretty impressive. And we have a really great faculty. So, and you're going to hear from some great graduates tonight that I'm really proud of. They've come a long ways. So I don't have anything else to say. I'll give it back to Carl and let the speakers present.
Thank you so much, Missy. Yeah, I mean, I was just going to say, we have some really cool speakers tonight, and I actually am really excited. We're going to kind of go down the line, but first I'm going to introduce Jessie Fleming, a member of the class of 2010, Vice President of Surgical Services at Guthrie.
Yes, good evening. My name is Jessie Fleming, Associate Vice President of Surgical Services for the Guthrie system. Thank you for having me this evening to provide an overview of my career path and also to talk about how COVID has impacted surgical services within our healthcare system. So I've been a registered nurse since 2011, just passing the NCLEX just a few short months after graduating from EC. And although I miss my professors and classmates, I have to admit there hasn't been one day since I started my nursing career that I have worn purple scrubs. I just had to throw that in there for a laugh. But But I started my career with the next 3 years working in the intensive care unit in the emergency department, and entered leadership in 2014 as a nurse manager of an inpatient medical rehab unit. Now, this was far different than the nursing I was accustomed to, but it was a great entry-level position into leadership. What actually sparked my interest in leadership was my time spent as a bedside nurse, observing and watching my managers at the time. I had some great managers that helped me to realize that I had leadership characteristics within myself. My next position in 2015 was as the manager of surgical services at Guthrie Corning Hospital, where I was in that role for about 2 years. And despite being comfortable with this team, the emergency department was in dire need of new leadership. So administration had discussed this opportunity with me. And although I was very nervous and uncomfortable about leaving a stable and strong team in surgical services, I accepted this challenge as the manager of the emergency department at Corning Hospital for the next 2 years. This was definitely by far one of the best decisions I've made throughout my career, as I view this position as one that helped me to grow and progress. I was completely surrounded by an incredibly talented and experienced group of nurses and support staff, as well as many other managers and leaders throughout the hospital. Then one day, out of the blue, my previous boss, the vice president of surgery for the Guthrie system, approached me about another growth opportunity, and that was the senior director of surgical services for Robert Packer Hospital. So after some thought, I had applied and interviewed and was offered the position on an interim basis. And that interim position lasted about 6 months, which then transitioned into a permanent role. So my boss, the vice president, had retired shortly after, and after a few months, the replacement was still not identified. So a few months later, after her retirement, I was asked to assume system responsibilities, at which point I became the acting system senior director of surgical services. After 6 months in this position, I was encouraged to apply for the associate vice president position. After much thought and deliberation and the realization that I was already doing this work, I had applied and interviewed. This was at the end of January of last year, of January 2020, when I had finished my 3-day interview process and then entered COVID. It wasn't until the July 2020 timeframe that I was offered the AVP of surgical services position, as COVID was our primary focus after completion of my interview process. While managing surgical services at Corning Hospital, I had completed my Master's of Science in Nursing through the Chamberlain College of Nursing, the executive track, and I also obtained my Nurse Executive Board certification. I'm fortunate to have progressed through my career, and I attribute this to 2 main reasons. The first reason is that I've been fortunate to have incredible support systems throughout my career, experienced mentors, and colleagues willing to provide constructive feedback. A valuable lesson I learned early in my leadership career is that you must routinely self-reflect. This has helped me grow professionally. The second reason has to do with keywords I mentioned a few minutes ago: nervous, uncomfortable, and challenge. I learned early on that if you remain comfortable and get complacent, then you're not growing. By placing myself in uncomfortable positions or situations, this allowed me to develop the confidence that I really needed to successfully navigate through my career and the most challenging healthcare issue to date, COVID-19. In February of 2020, shortly after COVID-19 made its way into the US, Guthrie was having trouble procuring medical supplies, as were most hospitals throughout the country. We very quickly identified that many essential items needed for daily routine surgeries, such as sterile surgical gowns, bouffants, and shoe covers, were at critically low par levels because of the stoppage of imports from China. A task force work group was created within our healthcare system, and our supply chain was provided with a list of high-use daily supply items that would be considered a showstopper if we could not continue with procurement. Within 6 to 8 months, a 90-day on-hand supply of all high-use items were procured within our inventory. So that was an absolutely incredible accomplishment and a lot of teamwork from many, many different leaders throughout the organization. From March 18th to May 18th, exactly a 2-month time frame, all Guthrie entities had halted elective surgeries and procedures per state mandates from PA and New York governors. For those of you that aren't aware, the Guthrie healthcare system, which is neighboring Elmira College, consists of hospitals within Pennsylvania and New York State. So we do have to abide by regulations within each state. During this time period of 2 months, we were only completing urgent and emergent surgeries and procedures, which only accounted for about a third of our normal volume. As a result of the significant impact on revenue, nurses at Guthrie and across the country were being furloughed because we were not seeing the surge of COVID patients in our rural community hospitals. Did you ever think that we would see the day when there was not a demand for nurses? When I think back to that, it's mind-boggling. Emergency department visits had also drastically declined due to the fear of members of the community catching COVID-19. In some instances, emergency departments saw as much as a 50% decrease in their volumes. The 2-month halt on elective surgeries and procedures had an impact on about 3,300 of the patients across the Guthrie system in our communities between New York and Pennsylvania. It took about 12 weeks for us to catch up this backlog of surgeries, in addition to the normal volume demand when our elective procedures resumed on May 19th. COVID-19 also came with many process changes. Source control measures were implemented, such as removing chairs in our waiting rooms to promote social distancing. Plastic shields were placed at all patient-facing registration desks. Masks and face shields were required for all staff. Temperature checks at each entrance. A negative COVID test result required for all patients having elective procedures within 5 days of surgery. A limited number of staff in each break room throughout all the hospitals, strict visitor restrictions, and a dedicated operating room for COVID positive patients or patients under investigation. Process changes were almost happening daily or sometimes hourly, depending on the CDC guidance, which caused a lot of frustration for our surgical teams and our nursing teams throughout the hospitals. Once the halt on elective procedures began, many of the surgical nurses that were not furloughed began orientation and training for redeployment to a med-surg unit should the surge of COVID patients happen. You can imagine the anxiety these nurses experienced, as many of them only worked in surgical services. Despite the many unknowns these surgical nurses were faced with, they jumped at the opportunity to support our med-surg nurses and provide care to the members of our community. Although we didn't quite see the surge of COVID patients last spring, this changed as we entered the month of November. By Thanksgiving, we had multiple inpatient units solely dedicated to COVID patients, and the surgical nurses were trained that were trained in the spring were welcomed with open arms to the various departments throughout our hospitals. Once again, surgical volumes were reduced, although this time around, not one employee was furloughed, as we needed all resources available to handle the number of patients coming into the hospital. The teamwork that was demonstrated and the outpouring support from the community is something I'll never forget. There were parades of cars that drove around the hospital with signs and honking to show their appreciation to our healthcare teams. Local businesses donated food and PPE almost daily. Handmade signs were placed around the hospital reading things such as hope and thank you heroes. It's these moments and random acts of kindness that I reflect back on when feeling overwhelmed, which quickly helps me remember why I chose nursing. And that's because of the difference we all make in the lives of our patients. I want to thank you all again, and Missy in particular, for inviting me to speak tonight regarding my career path, as well as the impact that COVID has had on surgical services. And with that, I would be happy to answer any questions that the group might have.
Anyone have anything?
We'll
Big group and a quiet group.
We'll have time at the end as well for some question and answer for the whole group.
I'd like to make a comment that's one heck of a wonderful summary that you gave, and it's a good thing that it's recorded. I mean, you may look back on this particular meeting just for that presentation as a historical phenomenon. Congratulations, Stuart, for your survival and advancement, and
Thank you.
well done.
Thank you.
Yes, thank you so much for sharing your experience. All right, next up we have Alicia Tamero, @7.
Hi, as Megan said, I'm Alicia Tamero. I graduated in 2007. Yep. And I'm actually from the Elmira area. So after graduation, I wanted to get away a little bit. And so I moved to Buffalo, New York, for the warm, sunny weather and 6 feet of snow. And I had always been interested in working with oncology patients. And so that was, something really deep rooted in what I wanted to do. So I went to Buffalo and worked at Roswell Park Cancer Institute. I worked almost 2 years on a med surg floor. And then I found one of my true passions was working in ICU. And that's kind of where I just felt like, where has this been all my life, taking care of critically ill patients. And one of my career goals was always to go to graduate school and become a nurse practitioner. And so after a few years of practicing as an RN, I went to the University at Buffalo and graduated in 2013 with my adult gerontology nurse practitioner license and got board certified. And I continued to work in critical care on a medical surgical step down unit, taking care of various patients, but primarily post-op thoracic surgical patients. And I did that for 3 or 4 years and then kind of transitioned to an outpatient pulmonary practice. And then my husband got a career opportunity to move our family back to the Elmira area. So I came back to Elmira area and had been doing teaching over the last, few years of my practice with some of the staff RNs and throughout our practice, and really had just fell in love with teaching and wanting to kind of encourage more people to join the nursing field and enjoy it and love it as much as I had and still do. So in 2019, I joined the nursing faculty at Elmira College. And it was really, I kind of had this moment when I came to have my interview with Missy, who had taught me when I was in undergrad, walking up the stairs of Coles Hall, which is the same steps that I walked up, to accept my diploma, how many years later. It was just a really cool moment. And when I was at Elmira College, Coles Hall was, I think, condemned at that time. And so it was really amazing to see the changes and how it had been updated, and the nursing lab, that lab that Missy was talking about in Carnegie Hall that was, left off the tour, was one that, I learned in. So it was really neat to see how incredible the new lab is, and the simulation mannequins. So when the pandemic hit, we were actually in the middle of the ICU rotation. I was teaching ICU clinical, and it was, really, really challenging to suddenly come up with, virtual, meaningful virtual clinical plans for the students, who a lot of students, and I think, as nurses, a lot of us are hands-on learners, which is why we're drawn to nursing. And so really hard to teach virtually when you can't put your hands on a patient, and in a field where social distancing is impossible. You have to be up close and personal with patients. And so that has been challenging, but and teaching virtually through Zoom and other, online platforms, making sure students are staying engaged. And I recently, with this course, I'm teaching critical thinking this term for the seniors, I discovered Zoom polling, and I'm obsessed with it. I do like so many questions, and the students can actually participate and, you know, answer the questions. And so there has been some advantages of, you know, that utilizing technology that has been there, but we just haven't used. We've also been using several, I don't know exactly what to call them, but nursing online programs that have, you know, virtual sim and kind of interactive case studies and things like that that the students can use. And so a lot of good has come from it. And then fortunately, we were able to go back to clinical this past fall, and, you know, just helping the students not be afraid of getting back into the hospital and taking care of patients. But also we were really lucky that the local hospitals were excited to have the students back. It had been months since they had students, and, you know, the nurses were so excited to see the students and have really been, you know, kind of trying to take them under their wings and show them things and get them the experience. And, you know, that has been a huge blessing. And we're really grateful for that. And the students are really grateful for that. Despite the many challenges, like I said, there has been some good that has come out of it. And over the last year, I can tell you, we have not compromised, you know, the high standards that that we hold our nursing students to here at Elmira College. And I can tell you that, you know, I would not be where I am in my nursing career had I not had, you know, the great foundation that an education that I got at Elmira College. And I hope that, you know, it can continue to educate and prepare, you know, the future nurses, and that they will enjoy and love nursing as much as I have, and will be successful. So thank you.
Great. Thank you so much, Alicia. That was such great insight, and nice to see it all come full circle. That's always exciting. Carl can attest to that too, I'm sure. All right, next up, we have Mary Campolita Legade, @9, who is a nurse esthetician. Hopefully I said that right. I'm a business major, so hopefully I did okay.
Thanks, Megan. I'm Mary Campolita Legade, @9, and I am a nurse anesthetist. For those of you that don't know what a nurse anesthetist is, I am the one that comes to meet you before surgery to say hi, and then I am the one that puts you to sleep before surgery, keeps you nice and comfortable, pain-free during surgery, and wakes you up at the end of surgery and brings you to those recovery nurses in the recovery area, where you hang out before you get to go home. My nursing journey has been kind of like a roundabout and interesting one. Ever since I was little, I knew I wanted to be a nurse. And so that was, you know, what I wanted to do. My journey to be a nurse anesthetist, it was kind of a roundabout one, in that I didn't really know what a CRNA was until I was actually well into my nursing career. I thought that I wanted to be a nurse practitioner, and that's what I wanted to do, and went into nursing school thinking that that's what I was going to do, and had my eyes opened once I was on my own. So I graduated from Elmira College's nursing program in 2009, and I took my first nursing job at Duke University Hospital in July of that year after I passed my NCLEX. I started on the cardiothoracic step-down unit and worked there for about a year. And I realized that I did not care for floor nursing as much as I thought that I would, and found my passion in critical care a lot like Alicia did, and loved the fast pace, taking care of the really sick patients, and using my brain in a much different way. So I found myself in the CCU at Duke for a couple of years, and in that time met my husband, who's also a nurse anesthetist, but we met as nurses at Duke in the ICU, and then made my way to the cardiothoracic ICU at Duke Hospital, and spent 3 years there, where I took care of patients with LVADs and ECMO patients, lung transplants, heart transplants, open heart surgeries, aortic surgeries, all sorts of things I saw that I can probably relegate now to like once in a lifetime experiences. So from there is where I kind of discovered what nurse anesthetists were and was exposed to kind of the anesthesia world. And because it seemed to be, that unit seemed to be kind of a stepping stone to go to anesthesia school. And it wasn't until I shadowed a couple of my friends that were CRNAs that I decided, hey, this is kind of a cool thing. I think I'd like to do that too. So in the meantime, while I was working in the cardiothoracic ICU at Duke, we put my husband through school. I applied, and then in 2015, I started my graduate education at University of South Florida, where I got my master's in nursing with a concentration in anesthesiology. So I graduated with my master's and took my CRNA certification in 2017, and I've been a nurse anesthetist since then. I currently live in the Tampa, Florida area. I work at a small community hospital where it's actually a lot busier than it used to be a couple years ago. And that's where I've been since I graduated school, and where I've been since the pandemic has kind of started. It's been interesting being in anesthesia or even in nursing during a pandemic, right? At first we all thought, oh my God, like, what are we gonna do? We don't have proper PPE, especially being in surgery and administering anesthesia, where I'm up in people's airways all the time. I'm mask ventilating them, I'm putting breathing tubes in them, places where you can get a really high viral load. I also work in labor and delivery, where those moms are huffing and puffing while I'm putting an epidural in, and they're like spraying their aerosols all over the place. So we were kind of uncertain as to what to expect or what to do. Our hospital really didn't have much PPE for us. So we were all kind of out on our own trying to scramble and get what we could. And so a lot of times we were told, you know, you have to use your N95 mask until it's soiled. So we were going like a couple weeks at a time. It's just been kind of crazy. Fast forward, you know, a year later, it's much better. Now they have a fresh N95 for us every day. And our surge of COVID patients, thankfully, has kind of started to go down in our small hospital. But every once in a while, we get one that comes through, especially in labor and delivery, because that's sort of like an ER where they come in and they don't get tested until they come, and you don't know whether they're positive or not until their results come back. But for all elective surgeries, everybody gets tested, you know, 3 days beforehand. And if they're positive, they don't get their surgeries done unless it's an emergency. You know, and that's really the only time that we see COVID patients now in my hospital, in the OR. Let's see. I mean, I feel like I had more to say, but I'm like having a brain fart. But
no worries.
Let me see, let me look at my notes here. I mean, that's pretty much it for, you know, as far as what I do. I will say that being a nurse in the middle of a pandemic has made me reflect upon a lot of foundational things that I learned from Missy when I was in nursing school on being flexible, adapting, and moving forward, because, you know, we have chosen kind of as nurses to be in this profession, to give ourselves to others, to, you know, take care of them like we would want our parents or our children or whoever to be taken care of. You know, so it's kind of a cool thing. At first I kind of was like, oh my God, I think I'm in the wrong career. I don't want to do this anymore. But now that I've been able to reflect back on it, I'm actually feel very honored and very privileged to be where I am now, getting to take care of these people in the middle of a pandemic, no less. And I think that, you know, my foundation from Elmira College has helped me, you know, grow and get to be where I am today.
Great. Thank you so much for that insight, Mary. Very much appreciated. So we're going to shift gears slightly, and we're going to have Nolan Oxley 2013, who is Associate Director of Admissions and Recruitment, give a little bit of an update on the pre-health programs that exist now at the college. Nolan?
Thank you, Megan. Hi, everybody. Ellen, you're down in Maryland, right? And I haven't seen Nate, even though you've been on campus. Even though everyone's here at Elmira College, we're following COVID protocols. So it's like, I see a student like once every 2 months getting a Starbucks latte or something. And it's like, we haven't seen each other in years. So it's like the best feeling. But yeah, no, so yeah, I graduated here in 2013 and I haven't left the purple bubble yet. So, you know, I was like, I don't know what I want to do. I'll take a job at admissions for a year, just see what happens. And now it's been 7 years. So I posted on Facebook today that I put up the class of 2025 banner in the office. So, you know, it's weird to think that when they graduate, I will have already been out of college for 12 years, even though I'm across the street from where I lived as a senior. But yeah, so I started working with our pre-health programs last year. So we have a partnership with the Erie College of Osteopathic Medicine. They're one of the largest medical schools in the country. And we've had a partnership with them for the last 5 or 6 years. But we ended up being selected as one of their fourth medical school, essentially. So about a block from us is a brand new medical school. Different architecture than Elmira. You know, everything here looks very historic, and Tompkins, you know, very, you know, from the 1920s, and they're very modern architecture. So there's this big medical school a block from us, and they just had 125 medical students start in the local Elmira area. Next year will be another 125 students, but they actually have 25 reserved spots for Elmira College students. So students can already get a secure spot in medical, pharmacy, or dental school as early as their senior year of high school. So for some of these students, they can, you know they want to go to Elmira, but they know they want to be a dentist. So they can kind of already have both of their paths lined up before they even come here and get their beanie. So, or hat, I should say, but yeah, still a beanie. But so this is just an amazing affiliation. They need a 1240 SAT or a 26 ACT. So flashback to you guys when you had to take those tests. This just allows them to bypass the MCATs to, you know, based off their high school GPA. If they have a 90 or higher, they can already get into medical, dental, or pharmacy school. With COVID and everything, it's been really difficult for students, as Nate puts on his beanie, I just noticed. So it's like on cue for him. But it's been difficult for students to take the SAT or ACT. So, you know, they can also apply for LECOM as a freshman or sophomore here at Elmira. So I've been talking to a lot of students, and, you know, for some of them, it's just difficult to know if they want to be a doctor at the age of 18. So they're going to start here in our pre-health track, work with Dr. Gilly for advising, and then they can still apply to LECOM as a student here. So we have other affiliations with SUNY Binghamton, SUNY Buffalo, but with LECOM a block from us, that's become our big new kind of development. So if anyone has any questions about admissions, I can answer that stuff as well. We're going to do an alumni note card project, both for accepted students to kind of encourage them to enroll at Elmira, but also in the summer to welcome our freshmen. We did that last year, and we're going to have alumni, hopefully again, write note cards and just have them in the post office for them to just kind of be their first piece of mail when they start here at Elmira. So I'll drop my contact information in the chat, and, you know, anyone who's interested in doing that, just email me and I'll be sure that you guys are included. So
Nolan, can I add something on real quick?
yes.
So in light of LECOM, we've started, probably it's been 3 or 4 years now, we do interprofessional simulation with the LECOM medical students. So we actually have a critical care simulation where our students and their students work together to take care of a patient, and they don't know each other. So it's more like the real world with a rapid response. And that has been very successful. And I anticipate once we get through COVID, the plan is to integrate more of those interdisciplinary simulations. And hopefully I've been in contact with Jim Bear in speech and hearing to try to pull in all of our health sciences so that students leave Elmira knowing what it's like to work on a healthcare team. as opposed to just individual healthcare. So that's something that we're working very hard towards, and hopefully in the next year or two, we'll have a lot of that up and running.
That actually is a great segue to one of the pre-submitted questions. So the question is, does the speech and hearing program interface with LECOM and or the nursing programs?
So the speech and hearing program's been under a lot of changes. We've had some change in faculty, which has made it a little bit difficult to get things going, but Jim Bear is now the director, and I've had some conversations with him, and I think, you know, looking forward, hopefully that's something we can pull them into, which would have them interacting with all of our students.
Great, thank you. And the other question that hasn't already been answered is, what new courses are being added that are informed by the pandemic? Anything surrounding mental health or things like that?
I can sort of speak to that. We haven't really added new courses. However, all of the Elmira College faculty are acutely aware of the mental health issues that students experience. And so they're reaching out more regularly to students. If somebody doesn't come to class, we're on email or the phone saying, where are you? We work very hard to, like, if they fail to turn in an assignment, we are quick to check in and say, okay, what's going on? What's your problem? We also have Jamie Panos, who's actively reaching out to these students too, in the same capacity. So they're not hearing only from faculty, but they're also hearing from somebody on the other side of the street that's saying, hey, she's in charge of tutoring and counseling or tutoring services. You're not getting your coursework done. Do you need help? Do you need a tutor? So we're kind of reaching out to them in multiple ways. And I think subtly faculty are integrating these concepts into their courses. I know I taught FYS this fall, and my whole FYS course was based on resilience and mental toughness and how to get through things with your brain. So, I don't think I'm the only one who's thinking about these mindfulness techniques that students could benefit from at this time to get through these hard times.
Great, thank you, Missy.
I had a question that just kind of popped in my head and it might be a question both for Missy and Nolan. Do you notice any change in the recruitment or the number of applications or any of those types of things, nursing, pre-health, considering that we're living through a pandemic? Do you think that there's any impact on people that would want to kind of jump into that world?
So I know for nursing is still holding strong. We've developed just such a program that everyone in New York State especially knows about. So nursing, we're still getting applications for that. I feel like we'll still be pretty close to around 60 each year for that. Obviously, it's still early. A lot of enrollments will come in. But, you know, applications are down slightly. But we are up in enrollments. So I feel like the one benefit of students having maybe more blended schooling is they're only in school, you know, twice a week. Unfortunately, their extracurriculars are scaled down, but then I think maybe they have more time to meet with us to talk about their major, to plan their next step. So we've been doing virtual appointments, and we actually just started on-campus tours again. So now students are able to come and tour campus, but they're not able to go in the building, so they can't see how beautiful Meyer Hall looks, or how, you know, Tompkins, or just all these buildings. But like, obviously our exterior of campus, our surroundings are beautiful too. And then it's freezing, so like our glasses are fogged the entire tour. Today it was like, you know, a snow blizzard, us walking around campus. But students, it's tough for them to make a decision when they've never even stepped foot on Elmira College's campus. So we're offering tours Monday through Sunday now. We even have Sunday tour options because with COVID, we have to kind of play catch up. Cases are down in our area, so we're able to, you know, welcome families. We just do individualized tours, just one family per tour. And then right now they're going out with us admissions counselors, and Nate, and, you know, tour guides are probably begging to give tours, but right now we just want to like keep the campus community and outside community separate for now. So
I would say from a student perspective, our students are weathering it pretty well. The seniors participate in COVID vaccine clinics regularly. So they're going out and they're vaccinating members of the community and doing their part in serving the community. I think the biggest worry that all the faculty have is the transition to practice piece. And, you know, we're going to rely on all of you that are in the clinical facilities now to kind of recognize this last year's been rough on these new grads, and they're not coming in necessarily with the same confidence that they would have had if everything had been normal. So we're kind of hoping the hospitals, I've kind of put some plugs in people's ears at the local facilities that, you know, our students actually got more clinical than average. In the state of New York, several schools got no clinical. Everything was virtual. And virtual is okay for concept. It's not okay for confidence or actual kinesthetic participation. And our students can tell you they felt pretty rocky when they went back, and you guys can ask them. That first week back was a little rough, and they had to regain that confidence that they had before the pandemic to get going again. And Jackie's shaking her head. So I mean, if you guys want to know, you can.
Absolutely. It was rough. It was rough this first few weeks back, but I mean, at this point, we're starting to get back into the swing of things. And like you said, we're doing so many, like, even just little skills, like communication skills with patients. If you don't practice that skill, you're gonna lose it. So this first few weeks back, I was like, how do I talk to patients again and not just my family? So it was a unique experience to go through for sure.
Well, and I think just to speak on that, I think it also bridges back to kind of Nolan's point with enrollment being down. I think a lot of students in high school have been struggling with online classes and are kind of questioning if they want to go into college starting on an online note, or rather wait towards the end of the pandemic to start looking at colleges. Because I know a lot of my friends who have been looking at grad school have been kind of questioning if they should go. I know one of my friends from back home deferred to law school just because he didn't want to do it online. He wanted to get that in-person experience and things like that. So I think that might be another issue.
Okay.
Any questions for our presenters? Now would be that time in the evening that we can do some open questions.
And students, if you have career questions, ask some of these folks. They've been where you are, and they can give you lots of advice.
I would like to ask Noah how people find out about the connection between Elmira College and LECOM. Is that well advertised? Do guidance counselors know about it? It sounds like such a good program that it should be drawing a group.
Yeah, we do have a main photo slide on the website. So it's one of the first things that students have seen the last 2 years. So I'm the point person for that. Obviously, a lot of students are interested, but they're very strict about the 3.5 GPA and the specific test scores. LECOM does have affiliations with about 130 other undergrad colleges. So that's been a challenge, but now that we have their fourth medical school, literally like a stone's throw away from campus, we're trying to market it as, like Missy said, that you can already meet LECOM medical students, get exposure to the 5 local hospitals, all of that during undergrad. And then you already become familiar with Elmira. And so your transition to medical school is much easier than, doing 4 years in Elmira and then going to like New York City. So yeah, but we're trying to get the word out as best as we can. We have pretty much unlimited spots with 25 for medical, 20 for pharmacy, and 5 for dental. We don't have 50 students looking to go those things every year, being a small school. So if a student's interested, they can take advantage of it. So
Thank you.
Yeah, of course.
Anybody have any other questions for our esteemed presenters, for the students? A question just came in. Any plans for a nurse practitioner program?
That's something we've talked about. Right now, we're in the process. We have a proposal into the state of New York to have an online RNBS program. So that's our current first step. And then the next step would likely be a master's program, but that'll take a little bit more work, a little more finagling to figure out, but it has been talked about.
I can chime in with a quick question. Mary, I'm just also interested in the CRNA track. And so I was just kind of curious what your suggestion and what you kind of looked at when you were doing like work experience prior to applying for schools was.
That is such a good question, Nate.
I try.
A lot of schools require you, obviously, you're going to graduate with your bachelor's. So you've already checked that off the list. Get yourself into the ICU like right away or as soon as you can. Because a lot of schools require you to have at least a year, and now a lot of them are requiring you to have 2 years of critical care experience. For me, because my nursing GPA was good, but the rest of my GPA was not awesome. And because anesthesia school is super competitive, do everything you can do to make yourself shine. So like while I was a bedside nurse at Duke, I taught classes within the heart center about heart transplants, lung transplants, pacemakers, different things like that. I was a charge nurse. I precepted people. I got my CCRN and any certification that I could get my hands on to make myself look like a better applicant compared to somebody who's walking in with a 4.0 GPA and like a year of ICU experience and, whatever. But I look at the clinical experiences where you're going to get to go be. The big push now for nurse anesthetists, and I know it's probably the same for nurse practitioners as well, is independent practice. I've lobbied so much here in the state of Florida and also the Washington, D.C. level for our profession to be an independent practitioner. A lot of my colleagues in the Western states like Seattle, Oregon, and such are completely independent practitioners, and that they don't need, supervision from an anesthesiologist, or a doctor of any kind or a surgeon, whatever, to practice. In Florida, where I am, I work in an anesthesia care model team. So it's usually one anesthesiologist that supervises 3 or 4 CRNAs. So it's all things to kind of consider. I always say, for reference, I went to University of South Florida for my master's program. I paid about $800 a credit hour. My husband, he went to Duke because we happened to be there at the time that he was going through school, and it's a couple thousand a credit hour. We have the same exact degree, same exact board exam. We got pretty much the same exact experience. So just, depending on where you want to go or what you want to do, those are kind of all things to consider as well. So hopefully that helped. If you have any questions, I'm more than happy to give you my email address and phone number, and you can reach out to me anytime and ask anything.
That would make my day.
Okay, awesome. I'll message you.
Perfect. Thank you so much.
You're very welcome.
I'd like to ask a question of Missy. Do we address midwifery at all? That's sort of a different phenomenon that nursing would lead into and could be a whole new area.
We do talk about midwifery. One of the problems with midwifery programs is that the clinical hours are tough to get. So midwives have to do so many deliveries. And if they can't get enough deliveries, they can't practice. So it makes it a little bit difficult. There are a few midwifery schools that people go to. And I don't think any of my new grads or grads over the years have become midwives, but I have a friend who did this, and, you have to keep up your deliveries. So, even the faculty who teach have to have so many deliveries a year to still be able to teach, and it makes it tough. So midwifery would be a tough one to add on, just based on our demographics and how many deliveries come through the area. It kind of works better in a more urban area where you're seeing multiple deliveries a night, every night and every day. So
I mean, the birth rate is declining.
Yes.
Holy cow. I mean, you can measure it in so many different ways. Thank you.
Yep.
Any other questions or even comments about people who weren't identified as speakers but have comments about their experience going on right now?
Lisa, what's going on in the military? Are you still doing military nursing?
I am, ma'am. Though it's been interesting since we were talking about COVID-19. When it all hit, I was over in Iraq. So I really didn't see anything to do with COVID because we were in our own little bubble on a base out in the middle of nowhere in Iraq. So, and then by the time I got back home, it was time to pack up and come here to Virginia to go to UVA. So, and that's my job right now, is just to be a student at UVA. It's pretty awesome. So,
Awesome job to have.
yeah,
And Allie,
yeah,
where
I
are
mean,
you
I'll
at now?
take it.
Sorry, was that me?
Where are you at now?
So I've actually been at Hasbro Children's Hospital on the pediatric oncology floor for about a year and a half or so. But actually, I just got back in January. Our census was pretty low, so I was at the COVID field hospital at our convention center, working like head on with all of the COVID patients that weren't quite like severe hospital level of care, but still need to be treated. It only further solidified that I never want to work with adults ever again and want to continue working with pediatrics. But I actually just got into grad school at the University of South Alabama to become an acute care pediatric nurse practitioner to focus in palliative care and hospice. So that's next for me.
Congratulations.
Thank you.
Definitely, congratulations.
Thank you.
This is Amanda Chavis, nursing class of '02. The one thing that I wanted to mention that I think has changed the most for me for the pandemic. So I started out in cardiac ICU in Connecticut, and in 2012, Yale New Haven bought us out. And then actually last year, I made the move to Pennsylvania, and I'm now doing post-acute care, and I work in a long-term acute care. And we are actually dealing with the COVID recovering patients. That's right now primarily our patients that are coming through. And the biggest change for me in my practice has been the fear of bringing something home. I mean, we all feel like bringing MRSA, VRE, or C. diff home, but I have, at the time, I had a 3-year-old and a 1-year-old. And the thought of bringing COVID home to them, I had anxiety every day. I set a decontamination area in my garage where I had my Purell and my Lysol and my uniforms, my shoes, like nothing comes in the house. And that was really the biggest change for me, is now there's something that is so contagious that I could possibly bring home to my family. Even though you take all the precautions at work, you still have that fear. I mean, we always had that fear ever since I started, but COVID was just a different ball game. So it really, and now actually I'm a certified wound and ostomy nurse. So that is what I do now. So it's really been a great, and of course I moved just as the pandemic shut everything down. And I'm like, oh, time to move, start a new job and do all of that with the added fear. But that was the biggest change I think that I've seen in the practices, that added fear of bringing something home to the family.
Speaking to that, kind of a similar thing, I think Nate and Abby can also agree with me. With going into clinicals this year, I know a lot of us had the fear. We all live in the dorms, and it's scary to be that person. Our friends and stuff look at us and they're like, you're dangerous, like you're dangerous to be around. And breaking that barrier between being like, we use PPE, we're safe, like we're as safe as possible. And it's just like, you don't want to be that person to bring it back in the dorm. So that was like a barrier to break down, even between not just like, I'm an RA, so not just like residents being like, stay away from me, don't talk to me, things like that. It's also friends, like, and just, we can't socialize very much. We have to socialize in our bubble. So just breaking that down so we're not alone all the time, and just really connecting as like a class of nursing students. It's really bonded us more than we ever thought or ever wanted to be close to each other. We've become close because of COVID. So something good has come out of it.
Totally. And the other thing too, especially with nursing students right now, is that obviously nursing is kind of the biggest major on campus, and we can't fit all of us into a classroom without breaking social distance guidelines. So I'd say even more so for nursing students, we have less opportunity in the classroom to actually interact with each other like at a face-to-face value. So it's definitely been challenging being a nursing student in these difficult times.
Yeah, and also our professors, I mean, Dr. Velino and Dr. Tamara, or Professor Tamara, I should say, right? not sure. But all of them, what they were speaking to earlier about like checking in on us, they've really been so incredible. And we've been through a lot, all of us, and even them last year switching to virtual was a big hit that none of us expected, obviously, but they've been so great and they really do care about us. And it's just been such a crazy thing. And we love them a lot and we're so appreciative.
And I want to add that we had literally a weekend to come up with virtual clinical, one weekend. We found out on Friday and we had to have it up. And I mean, all of us had to pull together and figure out, you know, what can we do? We were fortunate. We have some vendors that gave us a lot of free stuff. Part of their thing was free access to stuff that we didn't have. So we're kind of grateful to them because they didn't have to give us those products, but they chose to. And that was from Lippincott and ATI. And, you know, we buy some of their products, but they gave us above and beyond to try to help us better provide virtual education. But literally no prep time. At least in the fall, we kind of knew it was coming. We were prepped. I think the fall virtual was a lot better because we had the summer to think about how can we cope with virtual. And we weren't virtual very long for clinical. One thing I was able to negotiate for the students is that even if class was virtual, as long as the hospitals will have us clinicals in person. So when everybody was sitting safe virtually, the nursing students were going to clinical because we have to, and that's what we do. They all had proper PPE. Nobody was put on a COVID unit, but they did have to go to clinical. So that's something that I don't think a lot of students had to contend with. But if you're going to be a nurse, I became a nurse when HIV was a thing, and people reacted the same way to HIV as they did COVID. They were scared, and the best thing you could do is proper PPE. So I think the students learned the value of PPE and following the rules and what it means if you don't. And that's something that stays with you the rest of your life. I don't think you ever forget it. So it'll make them better nurses.
Yeah, and I just also want to add, I think Mary mentioned about being flexible and willing to change. And I think these upcoming new nurses, new grads are going to be the epitome of flexible and going with change because they have had everything thrown at them and been able to adapt and, and still be successful. And that's a true testament to how much they really care about what they're doing and care about, being successful and taking good care of the patients. And our nursing students, they would rather, I think, not as much as they miss being with their friends and stuff like that, they would do whatever they have to do so that they continue to go to in-person clinical because they will tell you they do not like virtual clinical. They want to be with the patients and at the bedside, and that's where we want them to be. So, and to be safe, but.
Great.
Yeah, I was
Any
in that
other
Friday clinical with Professor Tamaro at Corning ICU when everything was getting shut down. And we found out around like halfway through our clinicals. The clinical started at 7. So we found out around like 8:30, 9 o'clock. And we were like, what do we do? Like, we're just in clinical. And Professor Tamaro was just like, I have no idea, but we got to be flexible. So it'll be good life experience.
Abby, I think that's one of the first things that your mom ever told me when she was teaching me in nursing school. And when you were just a baby, which I'm one of those alumni that remembers when Missy's kids were just babies, is that nursing is first and foremost, you learn how to be flexible and you just adapt. And, not everything is going to be sunshine and roses. And when it doesn't go your way, you say, okay, you can cry for a second, but you got to adjust your sails and keep going. So I'm so proud of you guys that are in school right now, because honestly, I don't know what I would do if I was in your shoes. I think about that now. I think about that at my hospital. We get nurse anesthesia students, and they were out of clinical for 3 or 4 months, and they came back recently. I guess it was over the summer, and with their PPE and things like that, but they hadn't done basic skills or anything, and they were like having trouble interviewing patients, and it was kind of nice to help them get back into the swing of things. And my sister is actually currently, she just started a PA program at Marist, and her first semester was completely online, and she doesn't start clinical until June, but even their simulation labs and stuff like that have been all virtual. And that's one of the things that she said to me, Missy, was like, this is awful. I hate all this. So the reason I'm doing this is because I want to have my hands on people and to do this, you know? So, but I'm so proud of all of you guys that are in school right now and coming out, because I think that's a pretty cool thing to say. You went to nursing school in the middle of a pandemic and that you're going to be pretty badass when you come out. I think that's awesome.
And I'm going to embarrass everybody. I think everyone that was invited to speak or that is a former student had a day where they didn't think they were going to make it through nursing school. So don't ever feel bad about that. That's what Alicia and I are here for, is to coach you that you can make it through. And I can remember several times with Mary, especially when, you know, she wasn't going to survive the next test, and she always survived the next test. So I think you have to keep in mind, and sometimes people fall down, they have to repeat something. I have several students, I could fill the room with speakers of cool careers that people have that went through Elmira College. So the people we have tonight are just a sampling. We've got people here that could easily come right in and speak that are also watching. So kind of cool.
I have a question too. What would you say to prospective high school students are the advantages of coming to Elmira College and the nursing program?
Oh, I can answer that. We have a unique program in that we still have liberal arts courses. Mm-hmm. So for instance, our students get to be like regular college students. They're not just nursing students. And I think that's the reason you're hearing about all these wonderful careers, because they didn't just take nursing classes. They took other classes too. They traveled. Abby, my daughter, traveled to Japan, not a nursing course, got to experience life in Japan. Not many places could a nursing student get to do that in a general education course. And I think that's what makes us special. Our students are better at grad school because of it, because they don't come in just thinking, I'm going to do all these tasks. And Alicia can speak to this. None of the faculty hone in on tasks. We always hone in on thinking. We want good thinkers, because believe it or not, in nursing, it's not the person who can put the best IV in that might save the patient. It's going to be the person who can think about a problem and come up with a solution that's safe, that's going to save the patient. All the people in the world can put IVs in. I could train any of you to do it. But thinking like a nurse, that's hard. And that's where we excel, because all those extra courses make you think outside the box, even when students don't think they need to take them. And sometimes they'll say, oh, I don't need that. Well, they do. And that goes even to like Allie was in a lot of theater classes, and that has contributed to her career. There's a lot of benefit from a theater class and learning to, you know, play pretend with a child. Who better than a theater person? It probably plays right into what you do as a nurse. So I think that's probably our biggest benefit and selling point.
That was a beautiful explanation of the benefit of a liberal arts education along with the nursing precision. Bravo. I'm gonna expose something very, very personal because I respect you all. I just spent the last weekend in the hospital. I had AFib, atrial fibrillation. I had an extreme bad reaction to the Moderna vaccine. Took all kinds of prednisone and antihistamines and all kinds of garbage. And the day 20, I got this AFib thing. I have to say it was the nurses in the hospital that were so wonderful. You guys are the ones that keep people alive. You're the ones that keep their spirits alive. It's your touch, it's that closeness where you're missing the clinical experience, right? The in-person stuff. Makes a huge difference. It never really occurred to me I was being manipulated, managed. I guess I was managed in some ways. I thought I was managing them, or at least I was being a nice patient. But anyway, it is a big mutual exchange. And I think you guys, I admire you. I respect you. Good luck in all that you do. You're doing well. Amen.
Thank you so much for sharing that. Are there any other questions or comments before I hand it over to Ellen to wrap things up?
I just have a quick
No?
question.
Oh.
Amanda, what was your name in school? What was your last name?
Caswell.
What was that?
Caswell?
Okay, so you were like right there when I was coming in, you were graduating. Yeah,
I think so, yeah. Yeah.
I thought so.
Yep, 2002. I can't believe it's been that long, but I loved Elmira, and I would do it again 1,000 times over.
I think I taught part-time when you were in your senior year. So
I was gonna say, I think you were just coming in. Yep.
Yep.
Perfect. All right, well then I'm going to hand it over to Ellen Himmelreich, 17, the Director of Alumni Relations.
Well, I just want to thank everybody, especially our presenters, Missy, Jesse, Alicia, and Mary. You know, we just appreciate your time and everything that you've been doing throughout this pandemic and throughout your career. It's been wonderful to be able to hear about your accomplishments. And thank you for your support of this event. And just want to say there's many forms of support that we are really grateful for, not only for our presenters, but for all of our attendees tonight, for our students. You know, you are what makes EC. So thank you for being here. It's great to see so many familiar faces. It's always wonderful on these calls to be able to connect in that way. And we just ask you to continue to support EC, whether that be attending events. If you're interested in being a presenter, or if you know anybody who would maybe like to be involved on that level, presenting at one of our events, please reach out to me and we can make arrangements and contact that person. Obviously, we always are asking for support financially to the college during these challenging times. But that also can come into, you know, Nolan's expertise of suggesting to potential students to attend Elmira College. And I think if any student or parent, you know, would be able to attend an event like this, they would probably make the decision, you know, to come. So again, thank you so much to everybody. We will keep you posted on future events. If you have any ideas or comments, just reach out to alumnirelations@elmira.edu. And I hope all of you have a good rest of your evening, and thank you so much. Good night.
Yes, thank you, everyone. Stay safe.
Thank you.
Thank you, everybody.
Good night.
Thank you for inviting us, students.
Thank you.
Appreciate
Great
it.
evening.
Thank you for coming.
Thank you.
Bye, everyone.
Bye-bye.
Bye.
Bye, Peggy.
Bye-bye, Carl.